This article provides an overview of some of the challenges that face physicians in the middle of their careers related to well-being, and then provides some solutions both for the individual, things they can do to help increase their wellness at work, and then solutions for the organization to help support their mid-career physicians. I'm Jennifer Ligabell. I'm a professor of medicine at Harvard Medical School and a senior physician in the breast oncology group at the Dana-Farber Cancer Institute. My article, Mid-Career Fostering Physician Wellbeing Over the Career Life Cycle, will be published in the November 2025 issue of Mayo Clinic Proceedings. So midlife represents an exciting phase in the career of many physicians. They've mastered their craft and have very deep clinical knowledge. They often have very broad patient panels and are starting to grow into leadership roles. However, this can also be a time of significant stress for physicians. There often are many administrative burdens as their clinical panels increase in size and as they may move into more and more leadership positions. There can be a sense of isolation as some of the individuals that they've trained with in the past have moved on to other opportunities. This can also be a time of increased stress between life and work, as many people have relationships and families that they are also attempting to balance with their increasing clinical work. So this is a time both of great enthusiasm and growth, but also can be a time of stress for physicians. So we know that well-being of physicians is very important. Burnout, sort of the opposite of well-being, is a syndrome of emotional exhaustion, a sense of low personal accomplishment, and depersonalization. This is very common in healthcare workers and physicians in particular, and it can have an adverse impact on patient care as well as on the productivity and overall well-being of physicians. This article really focuses on the stress that can lead to burnout in physicians at mid-career and provides solutions to help increase the well-being of the physician, which is good for patients as well. We describe some of the evidence for solutions that can help support well-being of mid-career physicians. Things like peer mentorship to increase connectedness between mid-career physicians and their peers. Things like coaching programs that give people essential skills for leadership roles and as their practices grow. We also provide some ideas about support for physicians through the organization in helping to reduce administrative burdens, things like programs to increase the efficiency of the electronic health record, ensuring adequate staffing, and removing the stupid stuff, as the American Medical Association calls it, to make sure that people are spending their time on things that are meaningful to them and that help support their patients and practices. We also talk about some of the special considerations for female physicians who oftentimes have more family-related responsibilities. We also talk a bit about community physicians as well as academic physicians. There's a lot less research that's been done for how to best support community physicians, and we offer some ideas that are extrapolated from some of the academic programs that have been launched. So we hope that this article can be helpful to those in mid-career faculty roles in thinking of ways to support their own well-being, and for administrators at hospitals as we think about nurturing the careers of this very important part of the physician workforce. I encourage you to read our article to understand some of the challenges that face mid-career faculty, as well as the opportunities to support. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.